Well, we are back with Dr. Melnick from Maryland. Dr. Melnick, tell me, when a person, let's talk about implants and dentures. Very obviously, dentures, again, like a bridge, had a long time, workability, and they still do. And I think right now that there's probably such a thing like a hybrid, where, like, you do some implant and yet you still have dentures, and by doing so, I suppose, save money or whatever it is. Anyway, give us all the things which happen or not happen anymore once you have a denture. And maybe perhaps, versus implant. And again, point out the practicability or in some cases where, like, a denture is just fine and this is the way to go, or not necessarily, or, only because something new came out, like implants, doesn't maybe necessarily mean it's always the thing to do. Or is it? Tell us all about it.
Well, there are patients that get dentures, full dentures, and typically on a typical patient, there's a lot more support of a full upper denture than a full lower. Because with anatomically, with a full upper denture, you have not only the patient's bony ridge, but you have the whole entire palatal area that helps stabilize and provide retention for the denture. So generally, upper dentures fit pretty well on patients that have adequate bone support. Lower dentures, on the other hand, you have a thin ridge of bone and you have muscles that allow the jaws to open and close that tend to unseat the denture. So when patients have problems with their dentures, usually it's the lower denture that's the problem, not the upper one. But dentures that are made today, over time, start to get loose. The denture doesn't change, the patient's anatomy changes. You can understand if I were to, God forbid, Helmut, if you got sick and you had a prolonged illness and sat in a hospital bed for months at a time, your muscles would get weak from lack of use.
Right.
Well, when you remove teeth out of the jawbone, forces that are normally generated from our normal biting that go directly in the bone are now displaced indirectly through a denture. So the bone underneath the denture gets weak. And when it gets weak, the bone shrinks, gets smaller. So you have a denture that doesn't change over a ridge that does, and then dentures get loose. Not the denture that changed, it's the patient that changed. So one of the advantages of using dental implants for patients with dentures is that the dentures can sit over the implants. The implants in the bone will maintain the bone, so the bone doesn't get smaller over time. And you can attach the denture to the implants through a variety of attachments. So you can have minimally two implants under a denture. You would have a tissue-supported but denture-retained denture, so the denture wouldn't fly out of the mouth so easily. As you add more and more implants and you have more and more attachment, you get more stability and more retention. On an upper, you can have 6 implants and you could have a denture and cut out the palate. You could have individual attachments, you could have bar attachments, you could have a whole variety of ways. You could have a screwed-in hybrid denture, so there are many, many alternatives. The more implants you have, the more bone retention you have, the better retention of the denture down in the mouth.
I see. So basically what it boils down to, from what you're telling me here, that one of the big differences, you have a natural tooth, it has a root, and it kind of massages and makes the bone strong, just like exercise and normal living would, versus laying in bed with ammonia for 6 months or whatever it might be. You get weak. Or having a cast, that part of the body gets rather weak very fast because it's not used.
Absolutely.
And when that happens, the bone shrinks, which is what that does. And let me ask you, does that have anything to do where, like, when you look at elder people and they have denture for a while and they kind of look a little bit caved in. They look a little bit like a dried out tomato. Is that where that comes from?
Absolutely. Absolutely. It's a combination of the teeth wearing down and the supporting structures getting smaller, and their face looks caved in or their bite is overclosed.
And so basically, you start looking a lot older and more ugly than you really are. When your teeth are missing, and as more as they're missing, I suppose it kind of like compounds. I suppose you tell me if them is not so. Then your bones just start, more and more shrinking, and you don't start looking good, and you might now start thinking about getting Botox and other kind of facelifts, and they might not even work because the structure is so fallen in. So you look older when you have teeth missing, and you don't.
The Botox approach is the wrong solution to the problem.
Of course.
It's a matter of rebuilding the foundation and getting people back to their correct alignment.
Right. And so how long does it take to, have this, effect that your face now starts looking older? Because whether it's a 50-year-old guy or a 30-year-old girl, I don't think any one of us like to look 4, 5, or 10 years older than we look. I mean, I doubt it. You understand? So how long does it look? So let's take patients who, they know about that, what we just said, because I think that's a big factor. I mean, that would make me thinking of putting in an implant, for just looking older. So let's just say the person doesn't quite have the money. And he says, look, I just can't afford the 2, 3, or 4 implants right now. I gotta go for the denture. I gotta go for, whatever it may be. Is there a way to bridge over to say, okay, put a denture in now, but start saving up in a year or 2 or 3. If we put in the implant, we still avoid the worst. It's not so bad. And it's still a lot better than never doing it, or not.
Well, this process, the process of resorption does happen over time. So it's, you will get some initial bone loss within the first year, and then each year thereafter you'll get continued. In the first year you tend to lose width of the bony ridge, and as time goes on after that, you also lose height of the bony ridge. So it's not necessary that it be done the first year, but the longer you go, the more bone loss there is. One of the limits of placing implants is you have to have an adequate foundation. You have to have adequate bone.
Right.
So, even if you tend to lose more and more bone, there are ways of adding it back, but it adds to the time of healing and it adds to the expense of doing it. So the sooner you can get implants in there, the less likely you will lose foundational bone support.
Okay, got it. So very obviously you start losing bone immediately, and if it's really impossible financially or whichever way to do it right away, step on the gas pedal, try to get it done fast, because in 10, 15 years you will regret it by simply not looking even close to as good if you would have got an implant in it. Even though the teeth might look the same good to you. The teeth might, I'm sure that you guys make pretty goddamn good looking dentures. Right?
That's correct, but if the denture is not fitting well to a ridge that has gotten smaller, that's just going to propel faster bone loss.
Right. Okay, so bone loss is really the main problem here. Bone loss, and in itself it might not be the main problem, it's what the bone loss does. It makes us look ugly. I got it. All right. Okay. Thanks a lot, Dr. Melnick.